Well, good morning, everyone. I'm so glad you've joined us today. I'm Linda Speed, President and CEO of the Community Foundation of Southern Indiana. And we are very happy this morning to have Dr. Melissa Fry with us from the IUS Applied Research and Education Center to talk about our updated community needs assessment, the priorities for progress, and what the foundation discovered in 2015 when we had Dr. Fry produce the first needs assessment was that it was a resource that was very widely valued in the community, that it became something more than what we had anticipated. We had actually just wanted a tangible piece of evidence for our board of directors to use to guide our grant making out of our discretionary fund, but we offered it to the community as a resource, and it's become kind of a standard now, I think, for nonprofits and for government officials to use to look at to determine community needs and priorities. So we're very excited about this 2021 update, and I hope that what you'll hear today is an opportunity to learn a little bit more about where we currently are in our community, but also more importantly, I think, some leverage points where with the right investment and the right support, we can kind of start turning cogs that touch a whole lot of different things. You know, support this one thing, lots of things happen in a good way for the community. So I will turn it over now to Dr. Fry and let her tell you about the report.
Good morning. Before I get started, I just want to note that we do have Elizabeth Gillenwater and Holly Gavin here, who are both research assistants on this project. So I'm glad to have them here to sort of see what happens when we finish these things. So Priorities for Progress, Assets and Aspirations in Southern Indiana is a lengthy study that brings together publicly available quantitative data, survey findings, and community conversations about aspirations, challenges, and big ideas. I cannot possibly cover all of it this morning, so I'm going to try to give you a few ideas for using the document, highlight some notable findings from the profile data, briefly highlight some key findings from the survey particular to your role in local government, provide some explanation of our recommendations, and get your reactions and interpretations. You can find also a recorded version of my general public presentation of findings on the Community Foundation website, so if anybody needs that for anything, it's there. Some notes on function and design. Pay attention to the assets. We really tried to both use our survey to document, there we go, use our survey to document assets, but also we did asset mapping with community members. So we have long used the language of needs, but research indicates that focusing on assets can be a productive and empowering approach to community development. I think most of you probably know this. The challenge is balancing a focus on assets with the need to prioritize responses to the places where we struggle the most. So when we present respondents' ratings of community resources, we use the color green across sections to denote areas where survey respondents indicate that the community does well. Now, for the sake of being able to see them well, on some of the slides here, the bars are going to be white because it's just easier to see on these slides. Appendix B of the full report provides the asset maps generated through aggregated individual responses to a community asset mapping tool that we used at each community forum. Assets tell you about the resources on which the community can build to address challenges. It's really important to understand what community members think their assets are in their community. That's often different from what people who may live outside of a particular part of our community might think. Appendix C provides a listing of ideas generated when we ask people to imagine a world where money and politics were not obstacles. Take a look at what they told us they would like to see for their communities. From indoor and outdoor gathering spaces in Greenville to small business development spurred by Rails to Trails projects in Borden, our residents imagine a vibrant economy marked by community and civic engagement. These are our aspirations. As you know, engagement levels rarely reflect these aspirations. But I want to encourage all of you to take a look at the big ideas we heard, but also if your own big ideas are not reflected here, take a little time to think about your big ideas, share them, and consider how they could connect to or incorporate those shared by community members. Consider how the data in this report may help us navigate toward our community's aspirations. I especially encourage you to engage such visioning as you interact with systems change efforts such as Align Southern Indiana, the Homeless Coalition of Southern Indiana, Systems of Care, the Human Services Association of Southern Indiana, the Clark and Floyd County ECHO initiatives, and other efforts to bring together public, private, business, and nonprofit resources to work toward shared goals for our communities and for the region. Today, I'm going to highlight places where people with more resources and lower income respondents differ in their responses. My perception is that these may be your areas of greatest challenge. Whether it is elected officials, business leaders, or the boards of corporate or nonprofit philanthropy, the tables where decisions are made that shape resource pools are often filled with people who may not fully understand the challenges low-income constituents face. I'm also going to show you places where your perceptions, those of elected officials, differ from other groups of respondents. Please note, these are not statistical comparisons. Only 19 respondents indicated they hold elected office. The difference in sample size means these are not really fully comparable figures, but they still give you a description of the difference between what we heard from elected officials versus what we heard from the entire sample. You and other leaders in our communities make choices about where to direct resources. Some of those investments are about increasing quality of life and place for everyone, but sometimes you're going to want to target to the needs of those in our community who may be struggling the most, and that's where these charts should help you. Last, I encourage you to recognize the importance of mismatches between perceptions and objective data. These mismatches are often important opportunities for learning and growth. So priorities, I realize that's hard to read from back there, so I'm going to help you out a little bit with it. Overall, items identified as priorities by the largest share of respondents focus on basic access to education, health and wellness, housing, infrastructure, and living wages. That's because these are the foundations for everything else. While housing and living wages make this list, I do want to point out the considerably lower consensus on these topics than on issues related to health, mental health, substance abuse, education, and infrastructure. While I think understanding housing challenges has improved over the last several years, pushing for policies and practice that will bring incomes into alignment with housing costs remain a challenge. I think our data suggests the challenge is multifaceted. Mismatches in perceptions of wages, ideas about why wages are low, and experiences of housing costs. So I'll talk about that when we reach each of those. But I do want to note that elected officials saw housing as a much higher, were far more likely to choose housing as a priority than were the general respondents. So that's down here, 56.4% of the full sample, but 63.2% of the elected officials. Elected officials also were significantly, well, I can't say that, not statistically, but were more likely to select neighborhood activities as a priority. And you'll notice a couple other differences, more likely to note affordable health insurance that includes mental health care, affordable health insurance just for physical health, and then access to mental health services were all places where elected officials chose that as a priority in greater proportions than the sample as a whole. For elected officials, the social issues of greatest concern, the top three were adult drug or alcohol abuse, mental illness, and youth drug or alcohol abuse. I do want to just note, these are all obviously very much related and can be part of the same issue. These were slightly different for the nonprofit leaders, which focused on poverty, homelessness, and mental health. So just want to note that difference, but also highlight that this was fairly consistent with the larger samples focused on substance abuse. These are key parts of our system that work together and affect one another. Each exists in its own reinforcing feedback loop. Lower educational attainment tends to produce lower educational attainment in the next generation, for example. But they also feed each other. Higher levels of education improve health behaviors and earnings, and higher earnings make it easier to access healthcare, healthy food, and physical recreation. Stable housing supports stable employment, which can lead to higher earnings, which then impact health and make it easier for children to focus at school. Childhood stability and health produces stronger educational outcomes that generate higher incomes. I could go on with all the gears in this system, and so can you. When we shift any of these in a positive direction, it can and does cause positive shifts in at least some of the others. When any of them are going the wrong direction, it can cause problems in the others. When low-income workers do not have access to quality, affordable childcare, they may not be able to maintain stable employment, which reduces earnings and negatively impacts health. Reliable transportation is an equally important leverage point that shapes access to education, healthcare, and stable employment. The challenge for local government is that your role is limited in many of these areas. In order for your investments to yield the public goods our communities rely on, we also have to pull down available state and federal funding and coordinate with business and the nonprofit community. Government needs to operate where government is our best tool, places where markets do not work and where investment produces public goods from which we all benefit and on which we all rely for other aspects of our system to work. Government needs to be involved in those situations where we must assure that everyone has access to something and where all citizens need to be treated equally. These are appropriate good government roles. Much of what needs to happen in these areas, however, will have to include coordination with business and the nonprofit sector to deliver innovation, social, technological, and entrepreneurial. In competition, and also to drive competition that can drive fair prices and higher quality. Okay, so let's look at social capital in Clark and Floyd counties. Clark and Floyd counties are strong in many, have strong social capital in many respects. People feel a strong sense of community where people have opportunities to contribute and where those in need feel supported. These are strong assets on which to build. I do want to note that because our sample is skewed to higher income and education levels, we know that people in these categories feel this way. But respondents who may be more likely to experience deprivation or discrimination likely would report feeling less supported and might feel less connected. And we do see this in the responses around support for single parents. Still, these are strengths in the Southern Indiana region and as such can be an important foundation for progress. Public infrastructure, as you know, refers to roads, bridges, water mains, and other shared resources on which we all depend. Social infrastructure refers to built environments that promote social engagement. Public social infrastructure includes libraries, parks, and transportation. Respondents share strong agreement that you do these things well, though more than a third see room for improvement in making safe paths for biking and walking. Again, respondents largely feel good about how local government is doing in terms of public service, but road maintenance, code enforcement, and internet access, as well as safe options for biking and walking, present opportunities for improvement. Please note that trash pickup is not a public service in our area. It is privatized, but it constitutes a very important public good and is important to assess as such. With several layers of local government, residents express frustration that it's not always clear who is responsible for what. The region has county, municipal, township, and town governments all operating to meet the needs of residents. Still, most residents, 63.1%, are satisfied with local government. And I will note that in the community forums, there was a lot of discussion about road issues and figuring out which things were state, which things were local, and then of course the interstates being federal, and trying to figure out, like, sometimes they had complaints or concerns but didn't know where to go with those because of that dynamic. Priorities for transportation. This region wants existing roads and bridges maintained, and they want driving to be safe. But more than half are looking to a more walkable future where public transportation and multimodal interfaces. So when I say that, multimodal interfaces, I'm talking about biking or walking to bus or train, riding a train or bus, and then biking or walking to a destination. That's what people are thinking about. And they're looking at shifting us away from driving so much. Health. Access to physical and mental health care, as well as substance abuse treatment, were common themes in community sessions and came out as top priorities on surveys. And as I said, top priorities for government elected officials. Our 2015 work did not provide opportunity for these issues to come out as strongly, but they were present in open-ended responses at that time. This time, we have a fuller picture of the level of concern around substance abuse and mental health in particular. We know these issues cut across class lines, and we know that a chunk of our substance abuse issues are the direct result of self-medicating for untreated mental health issues, and that misuse and abuse of substances comprise and exacerbate poor health behaviors, contributing to poor physical health. Consistent with our 2015 findings, health behaviors remain a barrier to healthy outcomes in both Clark and Floyd counties. Obesity rates are higher than the state rate and much higher than the healthy and wealthy Hamilton County. This issue is partly driven by high rates of physical inactivity. And while smoking rates have declined some, they remain high at 22%. These patterns lead to lower life expectancy than the state, 2 times as many years lost to premature death as in the state's healthiest county, more poor physical health days, and more poor mental health days, which lowers economic productivity, lowers educational performance, and decreases quality of life. Substance abuse occupies 2 of the top 5 social issues of greatest concern in survey findings and also among elected officials. For Floyd County, a high percentage of driving deaths involve alcohol, and the overdose death rate is significantly higher than Clark County and nearly twice the state rate. Both counties are home to strong and active coalition efforts around public education and advocacy. A top priority and area of concern was access to physical and mental health care. Some community members note that these figures for numbers of residents per provider understate the provider shortage because so many of our surrounding rural communities are also counting on providers located in Clark and Floyd counties. One might counter that our own access to Louisville may offset that, but anecdotally, we hear story after story of residents struggling to access care, sitting on waiting lists for months, or simply not finding the care they or their children need in an accessible location. Local providers indicate that in addition to supply challenges, recent reductions in an already insufficient transportation system have reduced consistent engagement with mental health services and substance abuse treatment. Education. Here I want you to pay attention to what the objective data suggested in the area of opportunity and to some differences between lower and higher income responses and how you all see the picture compared to the rest of the respondents. This is really interesting because elected officials really had a different take than our other respondents. We combined Clark and Floyd counties for this table to make it easier to read. Clark and Floyd counties are behind state and national figures for graduate and professional degrees, as well as bachelor's degrees. A larger share of our population has associate's degrees or some college, no degree. The latter is the group that the Education Matters Southern Indiana effort intended to address. These 2 categories are likely where we find our people with trade certificates, many of which are earned through programs at Ivy Tech and Purdue Polytechnic. We have a smaller percentage with high school as their highest level of attainment, and that's good considering we are pretty close to national and state rates for 4-year high school completion. The less than 9th grade is generally a measure tied to the portion of the population between 80 and 100 years old in the community. Our lower life expectancy explains our lower rate. So the key here is that we are underperforming in 4-year degrees and higher, and outperforming in 2-year degrees and some college. To the extent that this reflects strong uptake in the trades, this may be good. Based on completion rates at IUS and Ivy Tech, however, I believe a significant portion of this figure represents college dropouts and stopouts. At IUS, we know that health and mental health concerns are among the most common reasons cited for stopping out, while financial challenges and the need to work are also drivers. These next 2 slides explain why this concerns me, and I think it seems to concern elected officials as well. This chart shows median earnings locally in the state and nationally for each level of educational attainment. In this table, the Census Bureau combines some college and associate's degree. Notice the significant jump in median income from that level to the bachelor's degree. That's from this level up to the bachelor's. The median in our area for that level of education, meaning half the people at that level of education earn more than that figure and half earn less than that figure, is about $37,000 compared to $47,000 to $53,000 for those with a bachelor's. The table here on your left shows you that generally we are doing quite well in graduating high school kids within 4 years. Dropout data are not a very sound science, but these data suggest we're doing pretty well on the 4-year high school completion front. This does not mean that we do not have dropout issues, but it suggests we are doing well on high school, and we have a larger share of people with associate's degrees and some college. Again, that's the category that likely captures trade certificates. But we are lagging in college and graduate level attainment. And yet, when we provided respondents with a list of possible priorities for education, 4-year degree completion comes in number 10 out of 10, excluding don't know. This was not true for among elected officials. So I do want to note 4-year completion, elected officials are in the red bar here, 38.9% made it a priority compared to only 22.9% of our full sample. College scholarships is in the #2 spot, which reflects recognition that cost is a barrier, and it is vitally important to note that half of respondents see early care and education for birth to 5 and after-school programs as top priorities, both of which are essential supports for families and vital for single parents. But as a region, there seems to be a failure to understand that lower educational attainment will place a cap on progress. I am admittedly a biased observer as someone who works at a 4-year institution of higher education and who holds a bachelor's, a master's, and a PhD. I also make a strong case against the College for All movement that led us away from supporting youth pursuing trades and forced lots of young people with no interest in college into our classrooms. But I think it is equally problematic to embrace trade certificates and high school level career pathways as a silver bullet. As a region, if we want a healthy economy capable of innovation and adaptation, we need high quality labor across diverse fields that require varied levels of education and training. And I just want to note, I believe that the elected official responses here reflect an understanding of that is not as widespread in the rest of our sample. And I think that presents a challenge for local elected officials to lead in helping the community understand the importance of college attainment. As we move into the economy, I'm going to start by triangulating your responses, lower versus higher income responses, and the objective community profile data. I will then move into a discussion of the clear opportunities, areas of unrealized economic potential in our local economy. So again, I just want to note for these ones where we've added in the elected officials separately, we've made them red so that you can see very clearly the differences between elected officials and other parts of our sample. In this particular chart, the full sample is the top medium gray bar. Business owners and for-profit executives are the dark gray bar. Nonprofit executives are the white bar, and then elected officials are the red. Nonprofit executives represented here in the lightest gray and business leaders represented in the darkest gray do not see the same parts of our economy and how it operates. So it is no surprise that they have different perspectives. You all have still another perspective represented in red, and your answers are quite different from either of the other groups. I want to take note of significant differences in response to the statement, our community has a strong labor force to attract high quality jobs. And that's this one right here. 31.6% of elected officials agreed with that, agreed or strongly agreed with that, compared to more than 56%, 56.6% of nonprofit executives, and then we were in the 40s among the full sample and business leaders. And in response to the statement, residents of Clark and Floyd counties can find living wage jobs across all levels of education and skill. That's this next one where you were more likely as elected officials to select that than were nonprofit executives at 44.2 compared to your nearly 57%. And then the business community was right split at 50%, the full sample 47%. Business leaders think our labor force needs to be more attractive and are more likely to believe that living wages are available across skill levels as are elected officials. While we look at economic development priorities by income level, lower income respondents are far more likely to select living wages as a priority, far more likely to prioritize sustainable development that protects natural resources. Note they are also more likely to live in close proximity to our worst pollutants. And they're far less likely to prioritize locally owned businesses, qualified working age population, and regionalism. Neither group is right or wrong. They have different perspectives on what the problems are and where the solutions lie. But the lower priority on qualified working age population paired with nonprofit executives' perception of greater agreement with the statement that we have a qualified working age population to attract good jobs is a notable contrast with the perspective of business leaders and local government. I just want to note a couple things here. Elected officials were far more likely to choose regionalization. I think that's largely because they know what it is. And I think other respondents are less likely to have a full concept of what that means, although clearly we have business leaders who would know what that is. Elected officials also more likely to select technical assistance for small businesses and responsible development or growth, and less likely to focus on living wages and less likely to focus on sustainable development. Although they say responsible development, and those came from different parts of the survey, so we'll have to look more closely at that to figure out if they were grouping sustainable development under responsible development. When we move to personal finance, this trend continues. Higher income respondents are far more likely to see workforce development training as a top priority than our lower income respondents. Low income people and those who serve them see that regardless of training, wages for large portions of the community are too low and are stagnant. Poverty among those who are working remains high, so jobs alone are not the answer. Moreover, those who have pursued trades, as noted in the income by education data, do not all reap significant rewards for those investments and skills. There is a mismatch between business leaders' rhetoric about the trades and the experiences of many of our working poor. We need to do more to understand this mismatch and address both workforce development and education and the region's wage structure. Priorities for Progress makes note of the income distributions of the two counties. Clark County's distribution is a nice normal distribution. Floyd County, however, has a somewhat larger share of its population at the ends than does Clark. Plainly, Floyd County is a more affluent community with a larger share of the population in the top 3 income groups. But Floyd also has a slightly higher share in the bottom 2 income categories. You may say those differences at the bottom are really small. They do appear that way. But we also looked at the income ratio. To calculate the income ratio, researchers place all the household incomes for the county in order from highest to lowest, then divide the group into 5 equal quintiles and divide the 80th percentile income level by the 20th percentile income level. The household income, counties with the highest ratings for health and well-being have an income ratio of about 3.7. This means that in these thriving communities, the highest income households earn 3.7 times what the lowest income households earn. The United States has an income ratio of 4.9 and is listed actually in the world among the countries with highest levels of inequality. And Indiana's is 4.4. Floyd County's is a relatively high 4.5 and Clark County's is 3.8. This finding suggests the need to lift the floor, which can happen in many ways tied to all different sections of this report. Good jobs with living wages are created and maintained when communities focus on the foundations of education, infrastructure, health, and safe, affordable housing. The gender wage gap in Floyd County is larger than at the state or national level, but Clark County is a bit smaller. This is likely tied to some of those very high earnings in Floyd County, which are likely men. As a society, we tend to place greater market value on masculinized work and less value on feminized work, even when the same level of training is required and the occupations provide comparable value to society. When an occupation shifts from predominantly one gender to be more heavily weighted to the other, the wages tend to also shift in ways that mean women who may have worked to enter a male field find the returns for their effort decline as women move into the field and it feminizes. Finally, women are less likely to negotiate, in part because they are socialized not to. Because single-parent households are disproportionately headed by women, the gender wage gap contributes to child poverty. Child poverty is a risk factor for various issues of concern in the region. This is partly because it limits opportunity, but also because financial hardship in a household can cause chronic stress, and toxic stress has physical impacts on the body that shape future health, mental health, education, and employment outcomes, as well as risk for substance abuse. So the gender wage gap is not simply about making sure women are appropriately paid for their labor. We benefit at the community level when we close this gap. On page 29 of the full report, we present both Clark and Floyd County data on the overrepresentation of Black, Indigenous, and people of color, or BIPOC, communities among our region's poor. The issue, again, is more pronounced in Floyd County than in Clark, but is a troublesome pattern reflecting historically rooted systemic inequalities in both communities. Addressing racial inequities has the potential to reduce poverty and all of its associated impacts, raise median income levels, and improve quality of life. Finally, the employment ratio tells us what % of each age group is employed. I like this figure better than the politically derived unemployment numbers we regularly track. Now, this number does not account for those who are unemployed by choice, stay-at-home moms, early retirees, people caring for a family member, or the like. Generally, Floyd County has higher employment ratios than Clark County, suggesting unrealized potential in Clark County. There may be some in Floyd, but we can certainly tell there is in Clark. The one category where Floyd County's ratio is lower is age 30 to 34. I suspect this is women of childbearing age taking time out of the paid labor force for those first few years until their children enter school. This is a common pattern, and more families in Floyd than in Clark have high enough incomes to be able to support one parent staying home for those first few years. But also Floyd's higher ratio may reflect, higher educational attainment, which is directly related to likelihood of employment, but increasing educational attainment could boost both employment and earnings. I want to note, I thought it was in here, but it wasn't, that the age 30 to 34 may also be low-income women choosing to stay out of the labor force with young children because it simply does not pay to work if you have young children who need childcare. Overall, people like living here, and they generally feel good about the schools and local amenities. People are excited about the thriving downtowns, and they believe this is a beautiful place to live. Most say they want more connection, more engagement, more community. Our greatest opportunities to realize our potential as a region appear to be in educating and training a high-quality labor force. This will help us build and attract living wage jobs that can make a difference in our efforts to increase access to affordable, high-quality early care and education, mental health services, affordable housing, and art and cultural experiences. Improvements to infrastructure, including transportation, can provide additional leverage in increasing access to education, employment, services, and quality of place amenities. People in this region have lots of big ideas and aspirations for building vibrant small towns and local communities and a thriving region. They enjoy consensus in their focus on foundational concerns related to infrastructure, education, health, and housing, and at the same time seem to share a vision for new and innovative ways to develop the region around its assets. The report includes more specific recommendations in each section. Because I can't cover all of them today, I'm choosing not to suggest that I think some are far more important than others. The recommendations indicate that addressing our community's challenges and realizing our aspirations will require engagement from local, state, and federal government, for-profit businesses, philanthropy, and the nonprofit sector. They all have contributions to make to support progress in the region. Setting more specific priorities from across these areas will require application of clear criteria that takes all stakeholders' aspirations and challenges into account. I encourage the community to go where there is energy, existing good and effective programs or innovative new ones, and where there are people ready to do the work. That's where we will be successful. And more broadly, based on all of our data sources, I believe that health, education, housing, and infrastructure remain the key leverage points to affect changes throughout the community. We also need to pay careful attention to strategies for ensuring living wages across sectors and skill levels, and to issues of equity. Our findings suggest that the community would benefit from improvements in gender and racial equity, from institutionalizing systems and structures to support single parents, and from sustainably developing our rural assets to generate more social and economic activity in our small towns. We need to think in systems. We need to think about those places where turning the gears in one area is going to shift the gears in other areas. And when we do that, we will start to see ripple effects and a sort of exponential growth in positive outcomes for our region. Thank you.